V-Span, America's communication network for veterans. Welcome to the Veterans Special Programs American National Network, V-Span. Our spotlight tonight shines on Dr. Frank Yurasek. Dr. Yurasek is the chair of the acupuncture program at National University of Health Sciences, chief of the PTSD Veterans Clinic at National University, and he's also the attending acupuncturist at Stroger County Hospital. Dr. Yurasek is a returning guest on V-Span's Spotlight. When we last talked, we discussed what post-traumatic stress disorder is and what it isn't, and the trend toward an integrated approach to treating veterans. And now, the link between pain and PTSD symptoms. Welcome back, Dr. Yurasek.
Thank you.
Frank, the integrated approach, let's review what that is.
Well, it used to be that acupuncture in the United States was pretty much set aside, not looked or viewed on as mainstream, while in China, ever since the 50s and 60s, it had been integrated into the major medical environment, the hospitals where I trained, in fact. Lately, there's been a definite and deliberate attempt to bring it in and incorporate it as complementary to Western medicine. For instance, at Bethesda Naval Hospital, I was invited there to help treat Marine amputees using acupuncture, where the drugs were actually putting Marines into ICU for organ failure. Another example closer to home is Stroger Hospital, where we're working in the pain clinic, and the physicians there are concerned about the damage that long-term opiate use does for chronic pain patients. And so we pick up the torch when they've gone as far as they can with procedures or opiates, and we actually use this very natural form of medicine to help interrupt that pain signal.
I find it absolutely fascinating, Dr. Yurasek, that a process that's been around for 5,000 years, used in China, just became looked at, if you will, as something serious in the 70s. I think it came to the United States, if I recall, when President Nixon visited China or Korea, and he witnessed an operation where the anesthesia was administered via acupuncture, and that brought it to light. Now, as we are investigating this, you're finding a link between pain and PTSD. Explain that.
Sure, and this is fairly recent and fairly personal. I've been treating, we've had the clinic going at National for 2 years now, but lately we've had some very serious injury situations. An Army veteran who had shrapnel left from stepping on a landmine that got reactivated, that shrapnel in his leg, and it was really interfering with he's a farmer, with his ability to farm, with his ability to walk. That, on interviewing him, doing the initial case interview, was really bringing back a lot of those emotions of anger for when it happened, who did it to him, a lot of frustration, a lot of depression, a lot of grief. And it was real simple by putting a few needles in the points on his scalp. And that's a very important concept here, to actually stimulate remotely away from the area of irritation. When we did that, the pain went away and his gait normalized, and he was able to sit in the seat across from me without hunching over in pain. And when he came back 2 days later, because they said, we're not going to wait a week, I want to see how long this is lasting. He came back with his wife. He said after that one visit he was 75% improved, and those PTS symptoms of anger, of depression, and insomnia as well were all significantly improved as a result of the lack of pain, the reduction of pain.
Did this patient, prior to that acupuncture exposure, experience any talk therapy prior to this, or any medicine?
He's with a group, a large group. There's 50 of them, in fact, and I'll be going at the end of the month. Now we've got about 6 of them from that group carpooling, because word gets out. and I'll be going back to address them. They're all in talk therapy and in drug therapy, and they want more of what these guys are getting, or they want more exposure to it at least, to see what else can be done. Because let's face it, the drug therapy has side effects. The talk therapy is dredging out old memories, and you're basically pushing buttons, reactivating triggers, and this is really treating the body as a working unit. So the criteria I use, for instance, at Stroger, there's three things. A, is there a reduction of pain? That's not something you talk about, that's something your body tells you. B, is there an increase in function? Is the limb working better? Is the organ working better? Are the eyes working better? Are the ears working better? C, is there any significant reduction in the pharmaceutical therapy? So those are three very solid criteria. You don't need a group discussion to figure that one out. It's your body checking in with your body, it reporting back to you, and you telling the therapist.
Now, this is an amazing revelation to folks who are not aware of this third alternative approach to treating a very serious disorder. And of course, PTSD is not limited to just veterans. PTSD is trauma, children, child abuse, violence. But it's more prevalent, of course, within the veterans community because from where they come is violent and it's traumatic.
Well, we have in our clinic at National, we also have people who have been sexually abused and physically beaten up, women. We have first responders who have witnessed death or murder or killing of their partners. So it's anybody that has been, and there's secondary PTSD, that's family members. So we're treating it all there.
It's something when you hear the term PTSD, for example, if I had a toothache, I could explain that to you. You would know what that means. You could relate to my toothache. PTSD is hard to relate to, but as I personally was thinking, when I was 7 years old, I wanted to watch The Mummy at night with my dad, and he wouldn't let me. So I complained until he finally said, "Okay, you're going to watch The Mummy." He let me watch The Mummy and went to bed. I relate to that story, and it flashes back to me in a humorous way.
Yeah, now.
But is that a form of post-traumatic stress disorder?
Sure, there's a memory of the traumatic event, and there's fear involved there, there's anxiety, and these are two of the big ones. And then, of course, you add the pain piece onto it, and that would be the next piece. But wherever you're witnessing a traumatic, painful, fearful, anxious event, car accident, you have that. See, and this is what a lot of people don't realize, muscle has memory. So you'll get the whiplash, and then you'll get the memory of the whiplash, and then you'll get the history of pain, particularly when it's chronic, and you're dealing with both the history of the pain and the pain in the moment. I love the one saying which goes that pain is inevitable, suffering is optional, because suffering is looking at ways to deal and cope with that pain.
Yeah. And I bring that up with your story too, is that many of us are probably more now aware of what this is than we were before. And when we talk about the needles, that could be something devastating to a lot of people, saying, the thought of somebody sticking me with needles is terrifying. Clarify that and make us understand the concept of acupuncture better.
I'd love to, because the questions that people come to the clinic with is, does it hurt? Will my insurance pay for it? And how many treatments do I need? These are the three big, but does it hurt is the first. And I tell them, well, first of all, there's the point itself. And it's about finding the right point that's going to interrupt the signal, or the right combination of points. The Japanese have a wonderful term for the point. It's called tsubo, which is jug. And that jug, that pain point, is either too full, which is excess, or empty, which is deficient. So you find the right relay point, and you activate it like Otzi did, the Iceman that we talked about last time. You can use pressure, You can use heat, and those are the first two very common and continue to be common ways to activate the point. And you can use the needle, which came around at the age of metal, but you can use laser, you can use sound, tuning forks. You can use electrical stimulation. There are a number of ways to stimulate that point and relay the signal through a network of points to balance the body's energy.
It's a fascinating concept, and we've only just touched on the subject. And we're talking with Dr. Frank Urosek, and when we return, you're going to meet Cy Bounds, who was the first PTSD patient who has taken the healing modalities, or the therapies, to a wider level of distribution and education through digital technologies and social media. This is V-Span.
Hi, I'm Ernie Scatton, Education Director here at Illinois Center for Broadcasting, the downtown campus. And I am also a U.S. Navy veteran. I served in the Navy from 1987 until 1991, and it was 4 of the best years of my life. They made me grow up, and they allowed me to do things that I normally wouldn't have been able to do, and they let me tap potential that I didn't know I had. But knowing that I had something to do with defending this nation or giving back to a place that has given so much to me and my family, it made me feel good. One day as I was on my way to work, I heard a commercial saying, if you want to be on the air, go to Illinois Center for Broadcasting. And I said yes. I called that day, I went that night for my test, and I passed, and in a week I was in school. I've never looked back. I walked out of school into a 50,000 watt station, ESPN 1000 here in Chicago, and I didn't leave for 9 years. I owe all that to ICB. You know, I guess to sum it all up, the Navy prepared me for life, but ICB prepared me for my future and what I have now, my future in broadcasting.
V-Span, the Veterans Communications Network. This is the Veterans Special Programs American National Network. Our V-Span Spotlight is on Dr. Frank Urosek, and a discussion on the direct relationship between pain and PTSD and an alternative approach to treating this anxiety disorder. We're joined by Cy Bounds, a U.S. Army veteran who served in Vietnam and who has been treated using this alternative approach. Cy, thanks for being here.
Thank you.
You have gone through the experience and the symptoms of PTSD. What got you interested in this alternative approach?
Oh boy. Well, I met Dr. Urosek through a friend of mine named Doug Larson in River Forest, Illinois. We met every week to talk about, Doug was actually creating a solar-powered design for a car years ago, and somehow or another the guy there said, I know this guy. We were talking about social media technology because that's what I specialize in. And he says, I know this guy that wants to talk about that. And somehow or another we called, and Dr. Frank was on the other line. And even back then, that was some years ago, he was thinking of the correlation from distance learning with this. And that's really how we met, really, on the phone.
You attended a free clinic, and Dr. Urosek administers free clinics to veterans, so you attended one of these sessions?
I certainly did. I wanted to learn more about it, and it just kept going from there. It's so rich, it's so simplistic, if I may use that term, that folks kind of don't think it's real because it really works, and it's been done for so many thousands of years, but it's really powerful, and I'm so happy that I met Doc, and now I'm able to share with my family and friends, and I think that it can really make a difference in the community. So I'm always trying to learn more about it. And as a Vietnam veteran, I've had an opportunity to see it close up and personal. I used it for some members of my family as well as myself. I've actually just stopped pain. I've had pain, and the techniques that Doc has given me, I've actually stopped. So I mean, these things are, they're teachable. That's all I'm trying to say.
Now, for clarification, what we're talking about is not acupuncture, and we're not saying we're going to give you a bunch of needles and then you're going to stick yourself using social media and tell you what to do. What we're talking about is acupressure, or I think the Korean hand therapy. So for clarification, we touched on this in the last segment,
Right.
Dr. Yursek, was that these pressure points can be activated and the pain cycle can be broken by using other methods rather than
Needles.
needles.
Exactly. Yeah, I just want to embellish a little bit, Cy's comment. We actually got together at a church social center, and I'd like to call it a faith-based community, because where we're going with this is the different communities, or in Techno Talk, herds of people with common interests. So Cy saw me working and invited me to work at this church using this Korean hand system called Suji. That's the Korean term. And Suji means hand, health, and wealth. Those three words. So it's very interesting. So I went there. He saw me work on people, all different ages, all different complaints, and get very instantaneous responses. It turned into an almost revival meeting setting, because the women there would get their hands touched and they go, "Praise the Lord, praise Jesus," and they'd walk around and their knee would be, and here's the thing, to go full circle, we just left another group. In this case, it was a senior center community. Earlier this afternoon, he's got about 15, 20 minutes of footage where the same deal happened. These people, mostly older, had hip pain, neck pain, shoulder pain, and I would take my pen, I call it a Bic treatment, I would roll on the part of the body and say, and stress that this is something you can do yourself. I will roll, press, that's the acupressure part. So roll to find it, press to, I tell them to mark it, but I'm actually treating it, and then take a small Vicaria seed that I get from China with the seed on the front and tape on the back, and I talk to this faith-based group about the power of a mustard seed, okay? Because I'm all about putting it in the vernacular. I peel the mustard seed or the Vicaria seed off and put it there, and I say, that's a reminder, and I squeeze it. I always stand to the side because I don't want to be either kicked or punched. I stand to the side and I said, okay, what's that pain level? Because I always ask them first, what is it? Because remember earlier we talked about, you want to know about improvement in function, diminishment of pain, and less meds. So I ask them, what's the pain level now? And there will be a significant drop in that pain level. And I'll say, okay, get up and walk, or go ahead and turn your head or move your shoulder. And I'm telling you, because you've got a theater there, you've got ripple effect. So they're all going, ooh, ah, and they're starting to line up. He saw that. That's what got him to PTSD. From PTSD, he got me into other venues, and we're really looking at the power of technology to take, this is, you've heard of distance learning, this is distance healing, because all you need, all God's children got hands, huh? All you need is the information about where it hurts on the body, and you tell that person. It reminds me of the definition of a consultant as someone who borrows your watch to tell you what time it is and charges you. You borrow the person's hand, you borrow their energy, and you show them where to press, to roll, press, and rub to take care of that pain. And it happens because, as we talked about earlier, and we'll talk about a little later, there's this aspect of beating the signal, the pain signal, to the brain.
How physically does this work?
Well, they explain it differently in China. First of all, they explain it in Chinese. But secondly, they use terms like qi, stagnation, and blood stagnation. And with qi stagnation, the pain wanders. With blood stagnations, it's fixed and sharp. And that can mean a difference with herbs. It does not mean a difference with pressure, other than you may use a point to move blood or move qi. But the point is, Western science talks about neurogate theory, that when you press the point, the acupoint, you literally beat the pain signal from the local area to the brain by pressing a pathway, a different pathway. So in physics, no two bodies can occupy the same space at the same time. It also works in pain relief or acupressure. You're beating the pain signal. You can do it simply with capsicum, which is a rub-on cream with pepper in it. Capsicum or the old mustard plaster works the same way. It beats the pain signal. It does a couple of other things as well. It brings the circulation to the area. So it's legerdemain. It's sleight of hand. I like the best definition which Rousseau said, which is medicine is about entertaining the patient while nature effects the cure. So at the very least, you're entertaining the patient with having them preoccupied with pain someplace else other than where it hurts, and when they suddenly back away, they've got relief.
And the symptoms of PTSD diminish.
Well, indeed, because those are all triggers. They're triggers for this anger, for this frustration, for this depression, for this anxiety. And you eliminate the trigger or significantly diminish it. But even more important, the farmer I was talking about with shrapnel in his leg, he's on the tractor seat or he made a long trip. He is pressing with his thumbnail the point on his hand to keep the pain under control and to sever that connection between the pain signal and his emotional signals.
And what you're proposing here is taking this information and through social media, letting other men and women know of this technique so they can administer it themselves.
Amen.
And there is no cost to it. No lines to stand in, no waiting rooms to be in. Administer it yourself with the knowledge. Now, I did some checking in on acupuncture specifically, and I assume that carries forward with acupressure, that this is now being accepted on a worldwide basis through the World Health Organization. I saw that the National Health Service of the United Kingdom has now accepted this for certain treatments, and also the National Institute of Health here in the United States. So when we look at that kind of support, although they're saying it for certain conditions, does that say that the sciences are starting to expand their acceptance of this 5,000-year-old technology?
I think it is. And, working with Dr. Torres at Stroger, who invited me in to, with interns from our clinic, she said, look, there are things called offsetting expenses that are the gain. We're not getting compensation from insurance companies for your treatments, Dr. Urasek, but what we're doing is we're able, as the pain is alleviated, to cut back on opiates or cut back on procedures, which are our largest expense. So you've got these secondary costs that are being significantly reduced. Nothing talks like money, and if you can save money at the second largest public hospital in the country by offering something that is fast, effective, economical, and has no side effects, underscored, no side effects, you've got something that's pretty good, stacks up pretty good.
And it would seem to me that if this process is embraced on a more ubiquitous level, we would reduce the amount of people who need treatment because they don't need the treatment anymore, and focus the attention on talk therapy where it applies, or medical therapy where it applies, and reduce the amount of veterans who have to wait.
We've got this bass backwards here in medicine, particularly in this country, I think. We call this alternative. I like to look at mainstream medicine as alternative. I like to look at natural medicine as fundamental medicine or functional medicine. If you can get to the problem early on and act in a preventative, proactive mode, then what you're going to do is you're going to reduce the symptoms, reduce the chronicity, and reduce the possibility of intervention unless or until it gets worse. Better to catch something small. There's an old saying, better to fight the enemy at the city walls than at your doorstep. So this early intervention, that's why you see in China, where I studied, old people in the parks early in the morning doing every variety of Tai Chi and Qigong. The women use fans and they wave them in a very ritualized manner. Why? To get the blood circulating, to get the energy circulating. We know that with elders, there's a direct correlation between movement and Alzheimer's or dementia. So you get people moving, you get blood flowing, you get chi flowing, and it's preventative and it's curative.
And it works.
And it works.
When we return, well, let me tell you, you're going to see how this works. You're going to get a demonstration right here on V-Span. If you're interested in pursuing a career in radio or television, look no further than the Illinois Center for Broadcasting. The Illinois Center for Broadcasting offers hands-on training in radio, TV, and web design. They offer financial aid for those who qualify and accept veterans' education benefits, including GI Bill Chapter 33 post 9/11. If you have any questions about the GI Bill Chapter 33 post 9/11, call the Illinois Center for Broadcasting at 630-916-1700 and ask for a financial aid representative. If you do not meet the GI Bill requirements, there's another option, known as the Veterans Retraining Assistance Program. For more information about the Veterans Retraining Assistance Program, call 1-800-827-1000 or visit the website at www.benefits.va.gov/VOW or call the Illinois Center for Broadcasting, Lombard Campus at 630-916-1700 and ask for a financial aid representative. V-Span, the Veterans Communications Network. Our V-Span Spotlight is on the direct relationship between pain and PTSD. Cybounds is being treated with an alternative therapy that we're now going to show you. Well, Dr. Urasek, how do you make this work?
Well, I have to say that we started with the emotional issues with PTSD, and we used ear points for that, and Cy definitely felt the euphoria, the natural euphoria that the points on the ear can do. And I'll let him tell what happened later, because he was familiar with the hand system where you treat the whole body from the hand, which is something that he can do. So Cy,
well, two things happened specifically. One thing happened. I was in my room and I tripped, and this is a year or two ago. I'm not quite sure, but I tripped in my room, and I meant to step over something, and it really hurt right in here. It really hurt very bad. I went downstairs and with my elderly mother, and I met her at the kitchen table, and she saw me there in pain. I had the chart the doc had given me. I knew that. I went to the chart, and I used the technique that was right on the chart. I mean, this stuff is just right there. It gives you 1, 2, 3 how to do it. And I hit the whatever correlates to this right here. I did it, and I actually got up and walked across the floor. And my mother, she just didn't believe that, but she did believe it. But it was quite awesome. The other time, my ex-wife was in the hospital, and she was in some serious pain. And Doc and I were going to a dinner, actually, with some other, you had invited me with some other Chinese physicians. I said, Doc, my ex-wife, but she's in pain, and excruciating pain. What can you do for her? And
I took a chopstick.
He took it right over.
I took a chopstick, and I said, where's the pain, Cy? Where's the pain? And this is an important point. The parenthetical point to remember is replicatability, that I can replicate for him and he can replicate for his ex-wife. He said the pain is in her leg and her low back. And so I said, okay, you're going to roll. I took a chopstick and I said, you're going to roll across the back of her hand, because it's the back of her leg. Her little finger of her left hand is her left leg. And I took the chopstick and I rolled across that. And I said, you're going to look for the speed bump, that is the painful area, and then you're going to press, and then that'll take care of the leg pain, and you're going to go to the low back, which is down here towards the bottom of the hand, which is the bottom of the body, and you're going to roll and then press and rub that point. And the next thing I know, I'm getting a phone call. His wife is crying over the phone and thanking me for what I taught Sai at a Chinese restaurant.
Doctor, you forgot, you did, because she had pain in both
legs.
in both legs and pain in the back. And I did the instruction from the back first.
Right.
And that was incredible. And she said, I said, is there any more pain? She says, yeah, in both legs. And then I did that one. I followed the instruction on that one, and I followed the instruction on that one. And in fact, Rich, in that hospital, there were doctors walking all around who were talking about taking tests. She was in pain. All they could talk about was take tests. And but anyway, this was just so incredible. So that's what really happened.
What I'm hearing here is that the next time I go to a Chinese restaurant, I'm leaving with the chopsticks. That's what I'm thinking.
Chopstick
Now,
acupressure.
There you go. Now, this breaks conventional wisdom in the sense that the tendency is that if my leg hurts, I go to the spot that it hurts and start diddling with it.
Yeah.
And now you're going to the pressure points that control that area
That's right.
and break the pain
That's
cycle.
exactly right.
Well, not only that, but the microsystem. So the hand is a microsystem, the ear is a microsystem, the scalp is a microsystem, the face is a microsystem. It works on the principle of the hologram, that the part contains the whole, which means any part contains the whole, which means you can access the whole body from the hand, as we talked about today, or the face, which is a Vietnamese system, or the scalp, which is a Japanese system, or the ear, which is a French system. All of these, it's kind of like the 100th monkey, where suddenly a monkey in some South Sea island starts washing the coconut, and 100 miles away another monkey starts washing the coconut. It's synchronicity, huh? It's things happening, evolving so that they happen simultaneously at some point in history. It's happening at this point in history.
Up to this point, we've been talking about physical pain. What about emotional pain, grief?
The great thing about the ear points is you can do treatments for ADD, you can do treatments for behavioral issues, which I did for 16 years for drug and alcohol addiction, and you can do treatments on specific organs that have specific emotional characteristics. So the kidney point on the ear is for fear, the lung point on the ear is for grief, the heart point on the ear is for agitation over excitement, and the liver point is for anger. So any of these issues can be addressed through the ear, and this is something that a family member, once they get the chart, once they get the way to stimulate the point, can do it on their family member.
And how do I get the chart? How do I get more information to become like Sai, knowledgeable enough to administer this to somebody in my family?
Well, we are actually putting up a website that will have basically a distance learning capacity or component, and we'll be making these tools available on that site. They can contact me at National, and then we'll have a link from there to our educational site. Because the progression, as we're doing here today, is information, education, application.
Our V-SPAN Spotlight was on Dr. Frank Yurosek. For more information, he may be contacted at the National University of Health Sciences at fyurosek@nuhs.edu. This program was made possible through the studios and future broadcast professionals at the Illinois Center for Broadcasting, Lombard Campus, where broadcasting careers begin. Visit beonair.com for more information about a career on radio and TV. You're watching the Veterans Special Programs American National Network. This is V-SPAN.